vaccines. That's one of the commodities that is usually used up, and even one of the commodities that's always lacking.
Incidentally, ma'am, yung dengue vaccine, what does the DOH plan to do with it?
At that present, Your Honor, of the 3 million doses, we have 590,000 doses in storage, and it is up for second dose and third dose in Cebu, and the second and third dose for selected Metro Manila cities.
So it has been used
So it can be used
okay.
up to July next year.
Then at present, what operational steps are your department undertaking to guarantee that no more medicines or drugs which may immediately be released to the general public will be subject to wastage or spoilage?
As I mentioned earlier, there is no such system with zero wastage or spoilage. We'll just probably agree with COA on what is acceptable, but some of the reasons also for expiring of drugs, some of these are actually donated, and then we've also mandated our hospitals and regional warehouses to do regular inventory, first in, first out policy, monitoring of stocks at the local level. We've hired several pharmacists to actually do the monitoring at the field level, proper planning of supplies prior to procurement activities, and return to supplier arrangements for replacement. And recently we've done hospital seminars in preparation for our PPMPs and the procurement law, Your Honor.
Okay, thank you. Madam Chair, just like to ask a few questions regarding the drug rehabilitation, because it has a budget of about 759 million. Madam Secretary, you are operating, the DOH is currently operating 13 treatment and rehabilitation centers, am I correct?
Yes, Your Honor, that's true.
Then, how many of them have been under, how many of those total who have surrendered? Now were treated, do you have any numbers as to how many were treated already in these 13 rehabilitation centers?
Yes, Your Honor. Of the 13 drug rehab facilities, we actually identified those that came in July 1. So we didn't record already those that came in before July 1, 2016. So of those who came in July 1, 2016, we've sent off or graduated about 2,553.
What was that? Yung pumapasok, ilan ho yung nagtutuloy at nagtatapos? Do you have any data on the percentage of those who complete the program? Meron ho kaya? Even just an estimate?
Yung completion of the program, Your Honor, is actually very high. Most of them complete the program, very few dropouts, Your Honor. But what we're trying to actually estimate now is the relapse rate, because we don't know, like if they graduate from Bikutan, if they go to Tagaytay or to the other rehab facilities. So we're trying to actually develop that tracking system so that we know if they relapse, Your Honor.
Likewise, does the DOH plan to add more centers from 2018 to 2022, or is the 13 rehab facilities enough?
Yes, no, Your Honor, the 13 rehab facilities is not enough. Actually, as of the moment, our census is about 12,263 in all the 13 rehab facilities. And if the estimates are correct that we have 1% of all surrenderies needing inpatient care, then we have 1.3 million surrenderers at the moment. That would mean 13,000 beds needed. So more or less, as of now, that is enough. But if the estimate, according to the President, is 4 million, then the 12 million that we have is insufficient by about 28,000 beds, because we need 40,000 beds if we have 4 million surrenderers. So as of the moment, we're in the process of building 8 mega. So when we consider a facility mega, that's 500 beds or more. And we have
like the one in Secretary, like the one in
Nueva Ecija. That's the first mega.
How big is that again, the capacity?
Actually, that was intended for 10,000 beds, but
it's funded by Chinese.
Chinese
is that in exchange for Spratlys? Yun ang pinalit.
It's 10,000 beds, but when we discuss in the interagency committee, it's not practical to actually operate it on a 10,000. So we're looking at 2,000.
It's being operated now? It's operational?
It's being operated. It was opened November 29, 2016. And we have currently around 423, 434 residents there. We graduated 53 last August 4, and we're graduating around 47 this coming end of the month. So currently we have 8 mega treatment facilities in the pipeline, which are donated, and also 5 for regional treatment centers. This is to complete at least 1 treatment center per region. So we have 12. And currently we have 30 privately owned treatment and rehab centers. These are usually very small ones, 10 to 20 beds. And we have 3 non-residential treatment and rehab centers or outpatient centers, Your Honor.
And likewise, Madam Secretary, to augment or to supplement the drug rehabilitation program, because not everybody can be relocated. As you said, there's 4 million as
Yes.
by estimates. Does the DOH have a community-based rehab program? Do you support or do you supplement the LGU's community-based rehab program?
Yes, Your Honor. Actually, the community-based rehabilitation program is really the DILG and the SWD together with LGU running the program. But the DOH supports it through our capacity building for the local health officials as well as paramedical personnel. And also, we provide training and capacity building and also technical assistance to local government units. So about 99% of the surrenderers would need outpatient care, 90% community-based, and about 6%, 6 to 8% would be outpatient-based care.
Okay, thank you, Madam Secretary. Madam Chair, just one more point, no, with regards to the major problem of DOH, which is the shortage of human resource. For 2018, you propose a budget of 9.6 billion for deployment of human resources for health. Do you think, Madam Secretary, will this already address the insufficient number of medical personnel, or until what year do you program in your program, will we be able to address this problem, yung shortage po?
Yes, Your Honor. Actually, we're really short of the health professionals for public health, for primary care. We need around 24 multidisciplinary health individuals per 10,000 population. Currently, our ratio is 14 per 10,000. So we're short of around 30,000 health professionals nationwide. So what we're proposing in this budget is the deployment of doctors, nurses, midwives, dentists, medtechs, pharmacists, family health associates, public health associates. So a total of around 22,000 individuals or health professionals, which is to cover the gap identified particularly in local government facilities. So hopefully, if their income from PhilHealth improves, their, shall we say, allocation from the internal revenue allotment improves, they will absorb all these health professionals at the local level. So what the DOH is actually providing is a stopgap until such time that local governments can provide the human resources needed.
And probably last but not the least, with regards to disaster situations, no? I think just recently there was news that there were certain deaths in the evacuation centers in Marawi. Just like to ask, what is the effective capacity of the DOH in health service provision during this emergency situation, and what improvements are needed so that we can supplement what the budgetary requirements, if ever?
Currently, Your Honor, we have 56 deaths recorded, and all of the deaths were recorded in hospitals, not in evacuation centers. And many of the deaths were residents of, shall we say, evacuees who were not in the evacuation centers, but they were staying in the home-based evacuees, staying with their families and their relatives. And if we calculate that, the 56 deaths recorded are actually what we would consider as background deaths, meaning that even if there was no health emergency, then those number of people will have been recorded to have died. So currently, many of the support that we provide are in the evacuation centers. So we believe that the support in evacuation centers is adequate. Our problem is the community or home-based evacuees, which it's very difficult to actually monitor them, Your Honor.
Madam Chair, if you may pahabol lang, no? Another current issue regarding Japanese encephalitis, no? How many confirmed cases have been reported, Madam Secretary?
Sir, as of August 27 or 26, that's the epidemiologic week report, there are 133 confirmed cases and 9 deaths. Last year we had 300. Yes, last year we had 313 cases reported. So we're actually lower by about 60% this year. And we had 18 deaths, Your Honor, so 50% lower deaths. this year.
So what has been our preventive strategy for Japanese encephalitis? Have we conducted in that period? What was the reason for the drop?
Yes, Your Honor. Actually, Japanese encephalitis, like dengue, is carried by a mosquito. It's vector-borne. So the most effective strategy to control it is what we call search and destroy, mosquito breeding places. So we lower down the population of mosquito, we lower down the incidence of the disease in humans. So it's following the dengue pattern. We have also lower cases this year of dengue and chikungunya. So it's really the mosquito population that's determining the incidence, Your Honor.
Would we need additional budget or allocation for elimination of this disease?
Actually, Your Honor, it's already included in the 2018 budget that we will be having an immunization program for Japanese encephalitis of around 260 million. Tama ba? 260? Yes, Your Honor. We'll be immunizing all children. Our estimated target population is 2.3 million children ages 9 months to 5 years old in the 3 highest affected areas of Region 1, 2, and 3, Your Honor.
Okay, thank you, Madam Sec. That's all, Madam Chair, for now.
I just have one quick question lang po, Madam Chair. Secretary, I don't know if you're knowledgeable about this, no, but in the discussion with the regarding the comprehensive tax reform, no, there are some other items that will be yung mga tax exemption that will be removed. One of which is rare disease, no. I think there's a rare disease law that's being, and I think a tax exemption privilege is being extended to that. Ano magiging impact ho pag rinipil itong exemption on VAT?
Your Honor, currently the rare disease is identified as one case for every, less than one case for every 10,000 population. So if we calculate that in the entire country, that's about less than 200 cases a year. So the impact on the population is actually very small because
impact
of
to the patients.
Currently, Your Honor,
Because I understand when they import medicine, VAT
it's very expensive, the medicines.
It's very expensive, but they don't pay VAT. No? They're exempted from paying VAT, so therefore they're exempted from paying 12%. What's the impact to the patients? Yun ang concern natin.
Yes, Your Honor. Currently, we're covering the rare diseases medicines through the Medicines Assistance Program. So we can cover...
You can augment.
Yes, Your Honor, even if it's a higher priced drug.
Okay, so in short, hindi masasaktan yung patients sa pagbayad ng additional VAT.
Yes, Your Honor.
Because we have other mechanisms. All right. Thank
we
you.
can cover for the medicines even if it's not VAT
So in
exempt.
short, you're agreeable to the repeal of this VAT exemption privilege to that law.
We support the train, Your Honor.
Okay. Thank you, Madam Secretary.
Thank you, Senator Sherwin and Senator JV. Can we proceed? You already have the computation for the zero. Then I'll go to my questions.
Yes, Your Honor. The calculation is about we need to construct 336,000 toilets in Metro Manila or the surrounding areas surrounding Manila Bay and Laguna, and at 2,500 per toilet, that would cost 840 million, Your Honor.
Thank you for that information. Could I request the DOH to communicate it to the Committee on Finance, and we will find the funding. At least we just make it scientific, make sure it's exact, because we're going to carve out from another agency to provide it. For Manila Bay region, for Laguna de Bay, lahat na yan, 800 million.
Yes,
We have
Your Honor.
DSWD OIC Emmanuel Leco, nandyan po sila, no? He's the OIC of this. I asked him, he came to see me in session, I asked him to listen to the DOH so that there's convergence between the two agencies. Because the 4-piece families, how many, ilan po, may we recognize, ilan po ang total 4P families? Mr. Leco.
Good afternoon,
Good afternoon.
Senator.
How many 4P
We have
families are there?
4.4 million households under
4
4Ps. 4.4 million
4.4.
households.
Okay. I wonder, will you be able in DOH to find out how many are the 4P families in the Manila Bay region, those occupying the sides of Pasig River, its tributaries, as well as Laguna de Bay? You'll be able to do that?
Yes, Your Honor, we can get the correlation.
So
and
this
the
is what we
data.
do. Just make sure that the figures you're giving me on the personal or private sanitary toilets needed in these 3 water, what you call them, bays and rivers, tributaries, not tributaries, but basta Manila Bay, Laguna de Bay, and Pasig bodies of water, we make sure that all the people living there are also covered by 4Ps. Second, among all those living in those areas covered by 4Ps, let's make sure that they are given livelihood through the still unspent Sustainable Livelihood Program of the DSWD. I understand that the utilization is quite slow because of the bureaucratic requirements and the way government is. I'm glad that OIC LACO has brought it to my attention, and only 20%, more or less, has been spent. It's already last quarter of the year. It will revert to Treasury. May I ask the DOH to help us spend it, meaning 4P families who are in need of livelihood, and if we give them livelihood, may connection yun eh. They'll be more hygienic. They will have the wherewithal or the means. But then we have 3 months only to spend the money. There's 7 billion. No, 7 billion?
About 7 billion.
7 billion still to be spent. But we cannot put it for toilets. We cannot realign it. Sayang nga eh. How is it possible that hindi tayo makukuha? The 7 billion, how do we use it? It's for livelihood eh. So all I can see now is the DSWD 4Ps in those areas. We will give, I'll find out in some, I will not say where I will get it from, that 800 million, but I have an idea where, so that we give them the toilets, but we also give them livelihood of the 20,000 per individual under the Sustainable Livelihood Program. Then I have another question. Does the DOH have a database? Of course they have, the poorest of the poor, but they need to be organized into an association before they can qualify into the SLP program. How can you help them spend their money while you provide the health services needed and they provide the cash, 2,600 cap? how are you able to share your database so that the SLP is accessed? Secretary.
Your Honor.
Yes.
We actually have around 9,000 toilet bowls, but we can procure more. And why don't we have all these families under 4Ps construct their toilet on a cash for work basis? They construct the toilet and the DSWD pays them. Pwede po.
For SLP, that would be a different portfolio. We have a cash for work, but that will be in another program. For SLP, that is strictly focused on livelihood or employment facilitation. So if we could work together to identify communities and individuals or groups who we can assist in building enterprises at the micro level, I think that would be very, very useful for us. But in fairness to our colleagues at the SWD who have been working all year round to do the social preparation, I think we have come up with a nice portfolio of enterprises that we could launch. But I think there are still enough resources that we can utilize that will help our communities.
Your Honor, another suggestion. Maybe the local 4Ps community can be a cooperative. They build toilets as a cooperative and they can be paid as the toilets are made.
Again, the Cash for Work is a different program. We already have that. The SLP program is strictly for livelihood or employment facilitation that will assist them to develop skills that are employable in the workforce.
Okay. So that's not allowed. Makukuha sila. So let's stick first to the needs of the 3 bodies of water and make sure that all these are covered by the 4Ps, and we'll take it from there. No, you can just sit and just listen and find out. That means really the SLP does not work, and let's see how we can carve out a portion for next year and put it in a program of government within your agency or another agency where it can be spent. Sayang eh, all of these good sounding programs are not utilized. Is there something you'd like to say?
I was thinking we have another program that I think would fit very well with DOH, and that would be the assistance to individuals in crisis. We assist individuals who are in the hospitals, and I was wondering if through a joint cooperation, those individuals who require confinement in public hospitals, we could easily facilitate assistance to them through DOH.
That's also, so the crisis fund is similar to the medical assistance program. Paano po nagkakaiba, and how can you help? Is that also an unutilized fund? But you don't need to, you don't need them to spend it. Naubos niyo, malakas ang map ninyo eh. Sa inyo pong crisis assistance fund.
Right now, the individuals line up in our offices, in the regions.
It should not be that way.
So that would be a way that we can eliminate that bureaucratic process if we can already work together, identify them, and make the referrals to you directly. And we're also thinking about the program for next year. If we can more efficiently implement the program through cooperation with the DOH, that will be so much better for...
May I ask the DSWD to prepare for your budget hearing, because I don't like the concept of the poor lining up in government agencies. That's dinosaur age of 20 years ago. Mahirap na nga sila, naiinitan pa o nauulangan at nagugutom at pinapag-antay natin. I don't like that. You have to find a more efficient way. Either download it to the hospital already, in regions, in provinces, in LGU hospitals, find out what is approved. Pakain mo kayo ng pagkain eh. Tama na muna po. Salamat po. Salamat. pakain ng pakain. Oo, masyado. Sorry, nawawala siya ang thought ko. So, yes.
Like to comment. I think many of the support of DSWD are non-medical, like the transportation expenses of the patients or the food and daily expenses of the bantay because we cannot feed them in the hospital. So I think that's what our support should complement, because patients in government hospitals, even if we cover all the medical expenses, still has out of pocket because of their stay in the medical or in the city away from their towns and provinces.
In fact, all these medical needs would not be this big if we had good nutrition. Which brings me to the Nutrition Council. Sino po ang head? Yes. Are you career? Bago po kayo?
Career po.
Sige. Parang hindi po epektibo ang ating mga nutrition programs. I would like to see more drive, more passion, more vision, mas masigla na nutrition program. And I will give you the budget needed. May I know, because ating mga ospital, gamot, lahat ito preventive. For example, in Western Visayas, ang pinakamataas po ng level ng stunting at ng undernutrition is in my home province of Antique. Yes. Why is that? And may I know what is the Nutrition Council doing to try to curb wasting and thinness and stunting and undernutrition? Ano ba ang kaibang programa nyo? I've been sitting here for almost 20 years, from 1998, and I want to see a more masigla na Nutrition Council, na nutrition program that really addresses the nutritional needs of our children. May I hear from you, please? And if it's budgetary, we will provide it. In fact, how much is the SLP for next year from the SWD? And aminado nila, they cannot spend it. They even said to take away 2 billion from them. I will put the 2 billion in nutrition, because if that's what's needed, the transfer from the SWD to Nutrition Council if needed, or a portion of it, because I'm scared to give it to you also, you may not know how to spend it. So, may I just briefly, please understand, what are your programs? You don't have to read the PowerPoint. I want to understand, what are the programs? What are you doing to intervene?
Thank you, Madam Senator, Madam Chair. Basically, the NNC is a policy and coordinating body on nutrition. Opo. So, in line with that mandate, we formulate policies and plans for nutrition for implementation of national as well as local governments.
So you don't, you're not allowed to implement?
We do not
I
implement.
see. Who is supposed to intervene?
We do provide technical assistance and token assistance for interventions to model the intervention. For instance, if for the first 1,000 days, then we can provide, we allotted 50 million for food assistance to pregnant women, because right now there's no institutionalized program for pregnant women. The implementation of many interventions, aside from the micronutrient supplementation, which are all funded by national government funds, rest on the local governments. So every local government has to be courted by us so that they can provide budget for their local nutrition programs. We provide...
You have a template of Nutrition 101, how to avoid, prevent, totally eliminate, and curb undernutrition, stunting, etc. in all local governments. So a simple policy, and we can fund it through the local government support fund or through the Nutrition Council.
We do have a template for the formulation as well as implementation, monitoring and evaluation of local nutrition action plans. And we enjoin local governments to support the implementation of such a protocol or a protocol.
Agad po ng local government ang malnutrition. Paano yan? It's like we're giving it away. We're giving away the future of this country by not taking care of our children. Will it be against the mandate of the DOH and the Nutrition Council to actually implement the policies? I don't think so. Bawal ba dahil sila ay policy-making council lamang na ako'y maglagay ng pondo sa inyo at bigyan nyo ng tulong ang mga kabataan para hindi sila maging stunted at maging undernourished? Makukuha ba kayo? Mapaplunder ba kayo sa ganun? I don't think so.
We're willing, Madam, to test if we're going to be, but in fact,
where do we lodge the funds? Because policies are policies. I can say, sorry to say this, we don't need policies anymore. We know what to do. By now, you would know what to do. You've been there for so long. I've been here for so long. We know what to do to help our children. We know where the areas where they're stunting and wasting and all of this.
Yes.
We just need to update it. Now, just tell me, please, give me a program, an aggressive program to curb malnutrition, and what is the agency that can best implement it with good absorptive capacity? Is it the SWD? If it's not in Nutrition Council, Pauline, hindi ba pwede ang DOH or DepEd, is it?
Madam Chair.
Yes,
Say, bahala na ang local government. If the local government does not care or does not make it a priority or reasons out that it does not have the resources, paano na? We'll just allow the children to be wasted? Hindi pwede. We have to intervene in the national.
yes, Madam Chair. Actually, the strategic thrust is actually food on the table. And in many areas, really the problem is the money to buy the food. So,
Don't give me the problem, give me the solution. We know the problem. What is the solution? And I will give you the resources to fund the solution.
ito, feeding programs at the community level and community vegetable gardens.
Very simple. We do that. Who is empowered, mandated, authorized to do it na hindi makukuha? Yes, yes. These two LGU heads can help me. They're both mayors. Please help me because I want to prioritize it. We cannot have a country of wasted, stunted children. Senator Sherwin.
Meron tayong local nutrition council.
Meron po, sir.
Then the nutrition office is already institutionalized. All LGUs
Yes,
may
sir.
nutrition
Yes,
office.
sir.
na
But
yan eh.
but many LGUs that are in geographically isolated and disadvantaged areas, these are the LGUs that have high prevalences of malnutrition, and these LGUs do not have the resources to
I think,
implement.
Ma'am, with your permission, siguro the first thing really is to come up with a mapping of all of this.
We already
LGUs.
have, sir. Yes, we
And
already
because
have.
the LGUs talaga, they have the infrastructure and the logistics eh. It's either you encourage them or you punish them eh. Yun lang naman ang pwedeng gawin eh, no? For those LGUs who are not activating their local nutrition council, their office, the local nutrition office is not functioning, then those are grounds for administrative sanctions, no? Especially kung alam nila na mataas ang problema doon sa kanila.
Ang malnutrition.
But it's really, to be honest, it's really a partnership within the LGUs because they have the infrastructure in place, eh, no? Doon po sa mga buntis, they go to the health centers which are controlled by the local government, no? So mata-track down nila kaagad yan, no? So
85% of pregnant women go to the health center.
health center,
Your Honor.
it's really how you put your office in touch with the LGUs, and I don't think it should be a mayor kumbaga driven program, no? You can really go straight to the council or to the office, no? Kasi institutionalized na yan eh. No,
Correct, Mr. Senator.
Ang trabaho lang po ng ating Nutrition Council gumawa ng policy. Pero yung ginagawa niyong policy, yung po dapat ang sinusunod ng mga lokal na pamahalaan
Yes, madam.
at ng DSWD bago mag-school age ang mga bata at ang DepEd pag-school age. Hindi ba ho?
Yes, ma'am. Pero ang the problem of
Ng DSWD.
stunting starts in pregnant women and children before they reach daycare age. Doon po tumataas ang stunting problem. So we need to address that particular age group. So meron tayo ng first 1,000 days intervention. Again, all the inputs required by the pregnant woman, for instance, iron folic acid supplementation, provided na yun. But the food itself, yun yung kulang.
With your budget in hand, no, with the budget in hand, is it enough to mobilize the LGUs? Especially those sa mga critical, the one you mentioned, nasa remote areas. Do you have enough funds to mobilize them and to attack the problem?
For this for this current planning period, sir, we have 36 provinces or areas that are focused areas. So we can and we will master the support of these 36 provinces and LGUs. But for the rest,
Feasible based on your budget
in the
allocation.
current
It's
budget,
feasible. We
yes.
can.
But the interventions, we do not have budget for the interventions. We estimate that we need about 5.7 billion pesos to, for instance, feed pregnant women, feed children below 2 years old. Also, these pregnant women are poor pregnant women, and then expand food production at the community and household.
That budgetary need should come from which agency? If you say that you're simply for policy and are not allowed to implement.
Right now, we do not have any specific agency to do these specific interventions because these are relatively new. No one is responsible for instance, feeding pregnant women at the national agency level, Madam Chair.
I don't understand. Hindi natin dapat hayaan na walang mag-i-implement ng isang bagay na napakahalaga. So we're saying the reason for stunting and for undernutrition is because the women are not fed properly. And we're saying that no agency, national agency, is in charge. How is it possible? How is it possible? Is it not the task of the National Nutrition Council to know the problem, the issue, and to identify which agency is supposed to implement that in the whole scheme of things? Take care of the children, the pregnant woman, hanggang mapanganak yung bata, hanggang preschool age, hanggang school age. Hindi ba ho, inaakay natin? We shepherd the process.
Yeah.
To say that no agency is in charge, how can that be possible?
It's the local government, Madam Chair, who's responsible for the implementation at the ground level.
Duty of the National Nutrition Council to monitor the local governments, that it should be following the policies that you actually have developed, and to, in your oversight function of the local governments, if they are actually implementing these nutrition policies. And, yes.
Yes, it's our monitoring function, Madam Chair. The NNC monitors local governments and also assess their effectiveness. But the performance of LGUs are varied. Depends really on the commitment of the LGU as well as the resource base of the LGU and their openness to prioritize nutrition.
Kamukha yung pagtatayo po ng community garden, gulayan sa paaralan, napakasimple po nun eh. It does not take too much budgetary allocation. Every barangay, purok, every home ay pwede pong may garden kung walang lugar, vertical garden. Ang malunggay, madali pong itanim. Ang bahay kubo vegetable, madaling itanim. Tingnan nyo sa Instagram ko, sa rooftop ko, ay gulay, no wasted space. Kaya po yun eh.
Madam Chair, may champion po ang food production. The Department of Agriculture provides the seeds, Then it's complemented by funds from the NNC for some planting equipment or planting other planting materials. So may champion siya even in the school system. The DepEd has already institutionalized the gulayan sa paaralan.
Let me just say that I really think it is the mandated duty of the Department of Health, aside from the other agencies like DepEd, DSWD, and DA. It's here, from 12 to 23 months, 6 to 11 months, for pregnant lactating mothers, etc. So it is your mandate. We cannot say that we are just doing policy at bahala na ang LGU. Hindi po ganun dapat ang ating thinking sa gobyerno. Secretary.
Yes, Madam Chair. Actually, we've outlined the food insecurity as a major problem in our malnutrition situation in the country. So we've identified what governors should be doing, like livelihood and employment projects, egg-laying chickens is the easiest. Municipal mayors provide food subsidies to poor families. An egg a day keeps the doctor away.
Are these programs of DOH?
Yes.
We can actually give food subsidies. It's similar to the DSWD's 4Ps, where they give up to 2,600 per family. The DOH actually gives food subsidies, especially to families who have undernourished children. Pwede ba ho yun?
What we give are RUFT or RUTF, that's ready-to-use therapeutic food. So it's packed high-energy food that is given to malnourished children already. Our problem is before they become malnourished, we have no intervention except for vitamins and supplementary
Do we have to wait for the children to be malnourished for us to save them? That's the wrong attitude. Dapat magtanim ng gulay sa bawat bakuran para yan ang kakainin natin and make it a habit. Lifestyle change, that's so simple.
We don't have health workers up to the barangay level, Your Honor. That's LGU health workers. And we empower them and we teach them that these are the important interventions.
Yes, you may not have the DOH personnel, but you have the capacity to teach the BNS, the BHW, what to do.
That's part of the capacity building that we give them, to put up gardens, to help the mothers identify nutritionally rich food, and to also do pabasa and nutrition intervention.
Gusto ko malaman, ang Nutrition Council, hanggang saan bumababa para turuan at sugpuin ang malnutrition sa bansa? Hanggang saan po kayo bumababa sa pagpahayag ng inyong polisiya na inyong napag-aralan o kayo eksperto laban sa malnutrition? Saan kayo bumababa? Hanggang saan po?
Madam Chair, hanggang barangay po, because we administer the Barangay Nutrition Scholars Program. So we have 42,000 plus Barangay Nutrition Scholars who
mga BNS?
Yes, we train them. We monitor their performance. We evaluate their. We also provide recognition for their good performance, and we also work with local governments on provision of their tools to render for them to be able to render their primary role of monitoring the nutritional status of children. We have a very modest amount to provide traveling allowance for them to be able to report or submit reports. But we do have tools, protocols, as well as modules for training barangay nutrition scholars. At the provincial level, our nutrition committee, as cited by our Senator Gatchalian, provincial, city, and municipal level, there are local nutrition committees, and these are chaired by the local chief executive, and they are also capacitated to do planning, assessment, monitoring, evaluation, and implementation of their local nutrition action plans.
But all of this, the fact that there's still rampant malnutrition means what we've been doing all these years is not working. All these buzzwords have been sitting here since 1998. I've been funding it as your chair for a couple of years. It's not working. The fact that there's a malnutrition of our children. So we must think of something out of the box and be more proactive in helping this BNS teach the communities. So what is that I'm trying to ask? What is that that I can help you with to make your job easier and more effective so that our children will be helped?
Madam Chair, our challenge really is the political exercise that we undergo every 3 years. At the barangay level, when the punong barangay is changed, automatically, most often than not, 50% of our BNSs are changed after 3 years. Then we retrain them, we train new ones. We also have a change of nutrition action officers after every exercise. What we really need is to scale up interventions that have proven successful. For instance, our first 1,000 days intervention, if we can scale up, meaning we reach more pregnant women, we reach more children below 2 years old with the appropriate interventions. We have laid out what these interventions are, but we need the mandate to do so.
You don't have the mandate to do that?
We cannot implement, but we can enjoin local governments.
That's right. You can enjoin them.
Yes.
You know and what the problem is, you know how to do it. And you can train, as you said, you continue to train BNS.
Yes.
So you simply empower the BNS with the tools and the knowledge and then allocate funds, not national funds. Can DOH actually help the LGU accomplish it, or they should use their own funds?
I think
you can.
Yes,
you can help
the
them.
national government can
of course
help the LGUs.
Yes.
Just a suggestion, ASEC. Just a suggestion, ASEC. And you know, one program that I really appreciate last time, no, for the LGUs, yung Seal of Good Housekeeping. It really promoted good governance at the LGU level. And yung mga kala nating mayor na alam lang mamulitika, they really perform good governance programs at their level. There are two very important things there. No? Number one is bragging rights. Alam mo, itong mga mayor gustong may bragging rights sila. Number two is incentives. No? And the incentives come in the form of projects for their constituents. No? So I think maybe we can emulate that model. No? I share the sentiments of the good chair na kailangan medyo aggressive eh. And we have to admit, the LGU really has the infrastructure in place at the bottom. How do you now mobilize that infrastructure, para ma-reach out natin yung mga kababayan natin at the grassroots level? And I think it's really a matter of program, coming up with that sexy program, na pwedeng i-implement at pagalawin ng mga LGUs. It has been done. That Seal of Good Housekeeping. I saw with my own eyes how the LGUs really mobilized to improve their performance in terms of governance. Maybe we can think of something along the lines.
Awards. We have an awards mechanism for local government, Your Honor. It's a Green Banner Award. And I think many of the local governments that are successful actually have received that award. Our problem are the 666 mayors who are in the priority list.
Secretary, you can partner with DILG. Kasi in DILG ang may mandate and general supervision over the LGUs. And I remember at one point, yung mga uncooperative LGUs, minigyan nila ng sanction . And hindi naman pinahirapan, but made it very inflexible for the LGUs. I think in this case, if you need to mobilize the LGUs, you have to partner with DILG because sila talaga ang supervisor ng mga LGUs in this case. Maybe include nutrition as part of the seal of good, wala na yatang seal, no? But whatever that program is, no? Maybe you can include that in that program. No?
Madam Chair, the National Nutrition Council includes DILG as a member, and in fact, the existing recognition and reward system is also institutionalized. The Secretary mentioned about the green banner. After getting a green banner for 3 consecutive years, then an LGU can win a crown or consistent regional outstanding winner in nutrition. And then after 3 more consecutive years of good performance, then the LGU could be a nutrition honor award. So that completes the cycle for the recognition for the nutrition program.
Is to the DILG because
yes.
Yung mga uncooperative yung 600 na uncooperative yun ang problema So I think this is now where you crack the whip, no?
I was about to mention that the existing recognition for LGUs has number 2 indicators, the nutritional status. So we've already worked with them to include nutrition as a measure of effectiveness of good governance.
Please cite me one LGU that is outstanding in nutrition when there are no stunted or malnourished, undernourished children.
Less than 1%.
Is that the best nationwide?
Batanes province has no
Santa Barbara, Iloilo, and Batangas, the whole province.
Batanes
Ay, hindi na pwedeng gawin modelo ang Batanes, iilan lang sila.
And also, well, Quirino province, the entire province of Quirino.
No malnourished.
No malnourished. Valenzuela City is one winner. And
pinapakain niya pa lechon
and in fact, the model set up in Valenzuela has been copied by many LGUs. The concessionary type of food production, food supplementation program. It's a very good model and many people have gone there, many areas have gone there and copied the system. We also provide LGUs with opportunity to visit and learn from good practices of other LGUs. But because we have limited budget, we cannot do that for many LGUs.
What is the budget that you need to be effective in the Nutrition Council?
Yes, we estimated. Because right now, if we do the ECCD, the first 1,000 days, we're just reaching 9 provinces, and that represent about 300 million additional budget for us for next year. But if we can double that, then we can increase the number of provinces that we can mobilize for good nutrition.
In your present budget, you can only reach 9 provinces.
For the first 1,000 days intervention, Madam.
But what is it that you can do knowing your limited staff and personnel? Ano po ang kaya nyo?
If we can use other modes, like for instance, we can source out training, we can source out monitoring, then we can perhaps reach more LGUs or more provinces.
And that would be how much?
Increase in your budget.
That's a total 5.7, 5.8.
Pero we cannot,
We can get a portion. What we had in our document was kahit half a billion muna to test it.
Madam Chair, can we be given time to pencil push? Because what we have is for the Philippine Plan of Action for Nutrition's additional budget, meaning these are interventions without champions. and that would cost about 5.5 billion pesos, including dietary supplementation for pregnant women, expansion of current nutrition-related services for first 1,000 days, like food expenses for nutrition education classes, food demo, support for community and home gardening, support for province-based nutrition information and education campaign, exchange visits, special events, and then support activities like social mobilization, training, monitoring.
Maganda po lahat pakinggan yan, pero sa papel lang yan at alam ko hindi nagaganap sa katotohanan. Kung tatanungin ko po sa inyo, ano ang 5 gulay na madaling itanim, na mabubuhay sa halos lahat ng probinsya sa Pilipinas, ano po yun?
KPMS po.
O sige.
KPMS. Kajos, papaya, malunggay, sigarilyas, at saka sesame.
Sesame?
Sesame for oil, ma'am, for fat. Sesame seeds.
Madali bang tumubo ang sesame?
Madali po yung i-propagate from BAX ATI.
Okay. Bakit po hindi natin i-mandate ang bawat barangay ay magkaroon ng gulayan na merong kajos, papaya, malunggay, sigarilyas at mani. Hindi. Sigarilyas at sesame.
Pero sesame is high protein,
alam ko na sigarilyas at mani eh. Wala. Tinatanim ko lahat yan. Ang wala lang ko sesame. Kasi ako'y weekend farmer eh. At ako'y bahay kubo vegetables eh. At ako'y ting umaga ay ako sa luyot at saka malunggay araw-araw. Mas awa ng Diyos niya. Kakasakit ilang taon natin. Hindi ako nagkakasipon. Lahat mga batang yan nagkakasipon. Ikaw, ito mga bata. High blood. You know, I'm much older, 15, 20 years. I mean, I hope I'm not speaking to, these guys are much younger, mga na-hospital. Thank God. I eat malunggay every morning. Malunggay which grows in my backyard and saluyot which grows on my roof garden. Nothing grand. It's just roof garden on my recycled containers. Bulang lang. Saan ang closing ko? Totoo hindi? Halika dito. Binabaon ko. Gulay. Di ba? Talbos ng kamote. Di ba? Talbos ng sayote. Minsan lechuga at arugula. Pero ako nagtatanim at akong gumagawa ng sariling compost. Di ba? Breakfast, lunch, and dinner. Gulay. Ang talbos ng kamote, napakadaling tumubo. So, ibig ko sabihin, magandang pakinggan yung inyong 5 billion na programa. I-mandate lang po natin ang bawat barangay. Maski na ang i-allocate ko na lang yung mga buto na kanilang itatanim. At yun ay mga barangay community gardens na yun po ang ipapamahagi sa mga kabarangay. Iba pa po yung mga gulayan sa paaralan na siyang tinatanim po ng DepEd. Hindi ba? For example, in Barangay Nyugan, in Tagaytay City, meron isang lugar ng barangay, sila may-ari, nagtayo ng MRF, kung saan yung basurahan nila at sila yung gumagawa ng compost, and then yung natirang lupa, yun ay gulayan at libre sa barangay. Maybe that concept of community food gardens, when anyone can just walk in and get.
Ma'am, winner po sa nutrition ang Nyugan. Sa Tagaytay.
Teko yun. Ako nagturo. Binahay-bahay ko yun. Nanalo sila.
Winner sila.
Salamat. Anong taon?
Siguro po 2012.
Hindi.
2012.
Hindi. Tinuruan ko lang sila after 2013. So nanalo sila even before me. Na now, I taught them solid waste management house to house. That's my barangay. And Potrero in Malabon. Kung sila, pinagmamarka nga, mayor sila, ako, kapitana. Diba, Yoli? Dinala ko si Atty. Doblon doon sa barangay. Kapitan lang ako eh. Kayo. So, no, but seriously, how do we, in short, what can I do to help you so that the policy making council pwedeng sumisid, hindi lang sa barangay, sa purok, sa sityo, para magkaroon ng paradigm shift ang pag-iisip ng mga tao at kumain ng KPMPS. S. Yes. So, ilalagay natin sa DILG, imamandate natin. So, craft me the language for DepEd, for Gulayan sa Paralan, similar language for DILG, and I will put little provision for the needs. If they say, walang buto eh. Ayan, sige, yan ang pera. Bumili kayo ng buto sa how many barangays? 42,000. Ilan ba total barangay? Exact number. What is our total barangay? 42,036. Are you sure? Yan na ba? 42,036? I-compute kayo na mag-compute sa Nutrition Council. Para magkaroon tayo ng gulayan sa bawat barangay.
Priority po is 16,419.
Lahatin na natin. O sige, yung 42,036 na barangays, marami dyan meron na eh. So, tingnan natin kung magtatayo tayo ng gulayan sa bawat barangay at kailangan natin bigay ang mga buto na 5 ito, magkano? Kung hindi naman, itong 16,000 lang, magkano aabutin yon? Yes, o protein na yan eh. Yes. O isama nyo yun.
Egg a day.
Pero yung pondong yun naman ang dapat ginagawa ng, ano
DA.
pangalan ng under DA? Yung hindi Daily Authority, ang tawag doon? Anong ahensya ng DA? Manok? Hindi Daily. DA yun bang DA? Ano nga ang pangalan ng ahensya?
ATI na po ngayon, dating BAEX, ma'am.
Bureau of Animal Industry.
Bureau of Animal Industry, pero yung sa extension po yung BAEX dati. Bureau of Agricultural Extension, which is now
It's now BAI,
ATI.
Bureau of Animal Industry.
Iba po yung BPI, iba rin yung...
No, I know that. So let us make sure in the BAI, yung pagbibigay ng manok sa 16,000 barangays na ito ay nandyan. No, but do you actually converge with them? Do you meet with them? In crafting their budget of BAI, the council, Nutrition Council, tell them... They are part of the national... Yes, they're part, but iba yung their part and they sit and but they don't do. So, do they know the 16,000 priority barangays? And in doing their budget to give away chickens, have they prioritized this?
We consulted with them.
Okay.
Madam,
Kayo na lang po ang kakausapin ko.
Apo.
So, ilagay po nyo ano ang kailangan sa 16,000 barangays na gulayan sa bawat barangay at merong manok. Ano ang kailangan? So, we will see where we can find it and where to lodge the budget sa BAI sa manok at sa gulayan sa barangay sa inyo or under sa DILG sa inyo na kung kaya nyo ipatupad council lang daw sila for policy eh hindi ka lang sisisid kayo tapos mga BNS ang mag-oversee. Could you kindly submit to the Committee on Finance wag makapal na accomplishment a one-pager on what are the interventions needed? And I don't, and this should be operationalized, yung kayang maintindihan na kayang gawin kung babasahin ng isang kapitan sa 16,000 barangays. Isang simpleng memo na ipapatupad natin sa kanila. Tapos na ba DILG hearing ko? Hindi pa? Hindi pa. Okay. Okay. I will be kapitana of the 16,000 barangays to compel them to manok at gulayan. Gulayan sa bawat barangay. And the same thing in DepEd, yung gulayan sa paaralan. Yeah. So you have to help me because you're the experts. You've been there for years, decades, right? How long have you been in Nutrition Council?
Since it started.
Which is how long?
40 years na po, ma'am.
Wow! 40.
From the when I left the university, that was my first and only.
And the issue of malnutrition has increased. Has malnutrition increased? Has it decreased?
It decreased and then it went up.
Oh, so what wrong thing did we do or not do What did we not do that it increased?
It went down when it was a centralized, when we had a centralized form of government, because we can mandate the agencies to target or to implement certain interventions.
It's been devolved.
When it was devolved, then we had to court each and
So
every
1992. From 1992,
In
nung
fact.
na-devolve, kasi depende yan sa local government
In
kung
fact.
ano ang priority niya.
In
Ang
fact,
priority
yes,
ba
ma'am.
niya drugs? Ang priority ba niya nutrition?
That is correct, Madam Secretary.
Hindi, lahat ay priority.
Yeah.
But this is basic priority. So it doesn't mean just because it's been devolved that we don't care. Because there are ways of teaching them through the BNS, there are ways of funding them through the ILG and through you and through DAOH and through DSWD and through DepEd, pwede pa rin. So let's not say na wala na tayong pakialam, policy na lang tayo dahil wala na sa ating responsibilidad. No. Just like it is not our responsibility as lawmakers to micromanage this, but we go beyond our job to do policies because we feel for it and it has to be done. We have to be pakilameras. And I will be pakilamera here in this nutrition. So please give us just a one-pager by this week, before my DILG and DepEd hearing, on what are the simple to doable interventions, including that 5 gulays for gulayan sa bawat barangay.
We will do that, Madam Chair. May I also add that we can also enjoin the DSWD because in the daycare centers, then we can also have gulay.
Good.
Gulayan.
So DepEd, lahat po ng paaralan, lahat ng barangay, lahat ng purok sa ilalim ng barangay, lahat ng daycare center. Pero kailangan meron po tayong modelo. Kasi pag sabihin gulayan, anong itatanim nila? Baka roses, baka bulaklak, baka hindi natin paggulay, gulay or baka man flowering baka hindi gulay ang itanim, baka anong halaman lang para mag-comply, yun naman ganyan o baka kung ano-anong, basta we should have a template, uniforme, pare-pareho, at yun na pag-aralan ninyo na yun ang dapat kainin na madaling itanim. Sa norte man na mainit o sa ulanin mang Mindanao. Yun. Hindi ba sa 7 billion hindi pa ginagastos ng DSWD, wala ba tayong maisip na paraan na mag-create ng associations dahil dapat accredited sa inyo, SLP associations, na livelihood ang pagdatanim ng mga gulayan na ito?
Pwede rin po yun, Madam Chair. Basta po, pang livelihood activity, pwede pong supportahan ng programa ng DSWD.
Okay. So, please, let's not make it difficult for them to comply. All 4-piece families in the next 4 months, September to December, can you please issue a memo tomorrow morning to all your people in the field to help them organize into associations, and the simple submission to them to be accredited would be to create a gulayan in the areas, and a sustainable gulayan where the first batch of seeds that we will give them will be continuing. That's a sustainable, that is literally a sustainable livelihood program where they use the food waste and the botelata plastic recycled as the basic elements. Seeds we will give them, the space is already available in the barangay or in schools or in daycare centers, and they can make their own compost. So that's literally a sustainable livelihood program.
Meron na po kaming mga programa na engaged in that type of activities, pero meron pa pong opportunity para i-expand.
Ibig ko po sabihin, dahil earlier nung session, nag-uusap tayo, sabi nga nyo, mahirap at masalimuot ang proseso at ang mga 4-piece families, we cannot expect them to think, ano bang aming pagkakakitaan, ano bang aming negosyo, ano bang aming micro-enterprise. Wag na. Tayo na po ang mag-isip. So between DSWD OIC and ASEC 40 years, ASEC Flores, okay, ay kayo na po ang gumawa ng isang basic template of a sustainable livelihood program consisting of nagulayan. So gulayan sa bawat bahay, gulayan sa bawat barangay, gulayan sa bawat daycare, gulayan sa bawat paaralan, gulayan sa bawat tahanan. So yun na po ang nationwide SLP. And please inform all of your DSWD in the grassroots to capacitate every 4P family para kasama po sila sa Gulayan Revolution na ating linilunsad ngayong gabing ito. Para po maubos ang inyong 7 billion pesos. Because if you do not spend your 7 billion, despite the fact that I am already teaching you how to spend it and already introducing you to each other, you will have dire repercussions in next year's budget. Galit na galit po ako sa mga hindi gumagastos ng pondo dahil marami pong nangangailangan sa ilalim. You know it better than me, I'm sure, how to implement it. Sec Judy would not have put you there if you were not very good. The fact that she took you away from AIN. And so, may I please request the National Nutrition Council and Sec Pauline, and which is under you, and the DSWD to craft a program of sustainable livelihood program for nutritious vegetables to be planted not just one time as a sustainable livelihood and to spend the 7 billion pesos. Huwag na sila mag-isip ng ano pa hong negosyo o micro-enterprise. I think that solved our problem earlier. I just need tiyaga, all of you, to teach, to organize it for them. Kaya po yun.
Can I also suggest that we mandate the LGU to buy the gulay? Kasi yun yung problema yung selling the products, and then when the LGU buys the gulay, papakain nila sa mga bata. Or
That Fed will buy the gulay, LGU will buy the gulay. If not, I will buy the gulay. Hindi, I'm just exaggerating. Of course, I will take care. Don't worry about that. I will mandate DILG. We will call the League of Mayors, the League of Governors, the League of Barangay. Gawin lang please ninyo. So, ang responsibilidad po ni DSWD ay i-associate sila, i-accredit. Pangalawa po ay si Nutrition Council sa ilalim ng DOH ay gawin yung project proposal na hindi kayang naisip ni 4P's family kaya hindi magastos yung pera. So build capacity and you accredit them, and then what is the program and what are the requirements. Then if you spend the 7B in the next 4 months and spend it in the 16,000 barangays that we mentioned and more. So they have the livelihood, we beat malnutrition. What else? Is that not good? Right? Okay. Chicken. Yes, and they include chicken. That's part of livelihood. You will buy chicks, laying chickens. But yeah, layers, and then that's part of the livelihood. Exactly what we talked about. That is the livelihood concept. Kanina pa tayo nag-iisip sa session 3 hours ago, paano kaya gustusin yung 7 billion? Because hindi nila, you cannot expect them to think of a micro-enterprise, of a livelihood program. It came out in this hearing that will beat malnutrition, and it will be literally a sustainable livelihood program. I hope I'm understood. I hope I'm not, my words are not falling on deaf ears, because by the time I hear DSWD on July or on September 21, this would have been rolled out already in all the 4P's families. It's only September 11. That's 10 days, meaning within the week, the program would have been done among the 3 of you. You have to sit down and do it, yes.
Ma'am, pinamove mo yung hearing natin because you want to attend sa DA.
Oo.
So, minove na namin ng 15. Dito lang available for your, for DILG.
DILG. Can I look at my schedule after this? DILG. Hindi DSWD.
Ang DSWD remain at 21.
Oo.
Yeah.
Correct me if I'm wrong. If I'm wrong, you tell me. Oo, pag hindi po implementable at hindi pasok. Shoot na shoot di ba?
Yes.
Sige po. Okay.
Madam Chair. Thank you very much for your suggestions, Madam Chair. We'll confer with Secretary Ubial and Assistant Secretary from the. Okay. Thank you very much for your inputs. We'll see you on the 21st, and we'll share with you what we have done from today. Thank you. And
it's a happy problem because you have 7 billion to spend. You said it's difficult to spend. Let's isubo na po natin sa kanila yung programa na gagawin ng National Nutrition Council at ng DOH. At ito hindi one time, hindi siya dole out, it's literally a sustainable livelihood program. Huwag na mag-isip, mag-cooperate sila. 16,000 ang targeted communities, barangays na nangangailangan yan. Ganun kasimple. And this is what I call convergence among government agencies. Yeah.
Salamat po.
Thank you.
May we be excused already so that...
Yes, you came for a courtesy call at 3 o'clock and I told them to stay. May bunga naman, di ba po?
Marami po.
Sige. Thank you, Mr.
At salamat po sa mga colleagues natin sa department.
Okay. Thank you. Okay. Ano? I'd like to know about your medical assistance program. Paano po pinapatupad ito? Is this already lodged in the regions or it's in the central office? And are the medical assistance programs supplemental of that, as we discussed earlier, that can't be covered by PhilHealth? And does it cover specialty hospitals and DOH-retained hospitals and LGU hospitals and barangay health centers? Ano ba ho ang sakop
Yes,
nito?
Madam Chair. Yes, Madam Chair. Our medical assistance program has a total budget of 3.9 billion this year and 4.3 billion next year. And it covers all DOH and public hospitals owned by the LGU. But currently we have ilan na nga ba yun? Around 236 smaller hospitals without memorandum of agreement with us, so we cannot download the funds to them. But
Memorandum of agreement, these are LGU-created hospitals.
LGU.
They have to go into MOA with DOH National for them to receive the map.
Yes. Yes, Madam Chair. And we also have memorandum of agreement with military hospitals, with state university colleges hospitals like PGH, and West Visayas State University Medical Centers. So we have a total of 555 317 with MOA. The balance don't have 283, don't have NOAA. And then what we do is we download a certain amount of money based on historical data. Like for example, PGH, we download 100 million, but if they spend all that funds, we can download some more. So about siguro 40% remains with the central office, because we said that sometimes some of the hospitals are fast moving, some of the hospitals are slow moving. Many of the specialty hospitals, heart, lung, kidney, and PCMC are fast moving medical assistance program. But as soon as their allocation is utilized, they just request from us and we download additional funds. Or even if we cannot download funds immediately, they just address the patients, whatever arrears we have from them, we download funds to cover that. So there's no interruption and there's no lag time in terms of providing assistance to the patients in our DOH hospitals.
Yung health enhancement facilities, health facilities enhancement program, the HFEP. Yes, this is the procurement of simply the procurement of equipment,
infrastructure and equipment,
both construction
yes,
of barangay health units and all the equipment needed.
Yes, Madam Chair.
Whether it is for equipment for specialty hospitals, sakop din yun?
Yes, Madam Chair.
Can it also assist LGU hospitals?
Yes, Madam Chair.
LGU created?
Yes.
And also the construction of barangay health centers?
Yes, Madam Chair.
What is the ideal scenario where every barangay is serviced? Is it ideal that every barangay would have a barangay health center, or yes, you can just cluster barangays?
Yes, Madam Chair. Actually, in the past, we didn't have enough budget, so we clustered the barangays. We have one barangay health station, for example, for 3 to 4 barangays. But now the plan was presented to the President and the Cabinet, and it was approved to have one barangay health station per barangay and one health worker per barangay. So that's our plan. And we're actually
plan, and is it reflected in your 2018
yes,
budget to have one barangay health center? So we can say by 2018, we have one barangay health center in every barangay.
Our shortfall is 9,600 barangay health stations, and our target is only about 2,000 per year, because our experience, we have the biggest number of barangay health stations projected in 2016, and it was very difficult to implement because of the very wide area of responsibility and coverage, around 5,000 barangay health stations, and many of those are not yet finished because of lack of buildable area.
LGU land.
Yes,
LGU must,
the LGU has to identify the area and donate it, and it has to be donated.
You're not able to use the present year and the past year's funds because of the lack of buildable land?
Buildable area.
So we should not fund this. Is that how it is? There's a problem of implementation due to lack of land.
When we targeted, we wanted to target 5,000 per year. It was very difficult, so we're now targeting only 2,000 per year so that we can actually manage the construction and building.
How many square meters is a barangay health center? Whether we call it a rural health center, or rural health unit, RHU, or a barangay health center or health station, pare-pareho na. We're talking about the same thing.
No, Madam Chair. The barangay health station is manned by only one personnel, that's either a nurse or a midwife, and it has about 3 rooms, so it's 60.
This is what we're talking about now, the
60
barangay
square
health station.
meters.
60 square meters, barangay health station, 1 nurse,
Or
and 3 rooms.
midwife, yes.
Or midwife. A rural health unit would have how many?
A rural health unit is around 200 square meters, and it has a full complement of around 10 personnel, sanitary inspector, a nurse, a midwife, a dentist, a med tech, a pharmacist, a doctor.
And if our target is to have 1 barangay health center in each barangay, rural health units would cover how many barangays?
1 rural health unit for every 20,000 population.
Are we able to cover that now? No.
We still have a gap.
What's our backlog?
Around 500.
Our backlog for RHUs is 500, and that's for
Yeah.
every 20,000.
545.
And
Yeah.
our backlog for barangays would be 9,000 of the 42,036 barangays. Is that accurate?
I'm sorry, Madam Chair. 545 is per year. The total backlog is 2,739 of the RHUs.
But kung meron na po tayong barangay health center sa bawat barangay, kailangan pa ba ng RHU?
Yes, Madam
Kailangan
Chair.
pa rin.
Yes. Because
Pero
that's
backlog.
where the doctors are,
Yeah.
dentists and all that. Yung barangay health station, usually what's done there is weighing, assessment, provision of continuing supplies like TB drugs, immunization, family planning supplies, and all that. But the consultation, the treatment is in the rural health unit because a doctor, dentist are there.
Would every barangay health center have basic equipment like a BP machine?
Yes.
A sugar tester?
Yes.
An oximeter? A
Na walang oximeter.
nebulizer?
Nebulizer.
Hindi ba kailangan may oximeter?
No.
No, hindi na kailangan.
Temperature.
Temperature. Nasa barangay health
Health
center yan.
weighing scale.
Weighing scale.
Yes.
So I would go to any barangay health center now and all of these must be present there?
Yes, Madam Chair.
Are we certain? Baka,
Yes.
baka building lang siya tapos walang laman.
Hindi. We do not build buildings without equipment inside. And that's the mandate, no white elephant. So we're looking at all the facilities that were constructed in the previous administration, and we're making sure they're all functional, Madam Chair.
Ano ho ang mga ready na gamot sa mga
Yes.
barangay health centers na pag walk-in ng tao ay maaari niyang ma-access ng libre?
There are a list of essential drugs like paracetamol, Oresol, Lagundi, anti-hypertensive, diabetes medicine, family planning supplies, TB drugs, basic antibiotics like cotrimoxazole and amoxicillin, particularly for children with pneumonia, and pain reliever like mefenamic acid.
What is a model barangay health center accessible to us we could visit and see not just its cleanliness and sanitation and aesthetic beauty, but also the efficiency of its personnel?
There are many barangay health, in Metro Manila, Ariel. Hindi, yung malapit lang. Sa Pasay. Ha? Hindi, dito. Pasay.
These are built by DOH and run by DOH, no?
No, Madam Chair. It's run by the LGU.
But you turn it over.
Yes.
You build it.
Opo.
And the personnel are
LGU.
LGU na. But the building and the equipment are given by DOH, turned over to LGU.
Yes, Madam Chair, but many of the barangay health station here in Metro Manila were actually there long ago. So these are the old ones. The new ones are built in the rural areas where there's a lot of disparities.
May I know how infectious waste is disposed of in all the hospitals, rural health units, and barangay health centers?
For our rural health units and barangay health stations, we have a septic vault where they throw the needles and syringes.
What's a septic vault?
It's like a septic tank that's really dedicated for infectious waste.
It's underground.
It's underground and it's being covered by concrete slabs.
And that's how it's been disposed of all these years.
Yes, Madam Chair.
Only for infectious waste. And are the other waste segregated at source, recycled, and composted in compliance with Republic Act 9003?
Yes, Madam Chair. It's supposed to be. We have 3 colored garbage collectors.
Can you please be very strict about it, because this is a law of 2001, and this is has direct impact to the health of our people, because I'm a great believer in prevention. If only we have gulayan, if only we eat well, if only we just keep on drinking
Segregate.
water, and if we segregate waste, then mababawasan ang mga sakit. Can I please request the DOH, if you could, Secretary, issue a strict memo to all these units for the segregation of waste, recycling, and composting.
Yes, Madam Chair, we will reiterate, we have already an administrative order to segregate the waste and to properly dispose.
And the food waste and the biodegradable waste, like if they have gardens or trees around it, can be put together and they can even make their own compost. And so the waste that will be collected by the garbage collectors will be much less. And so waste diversion will be much higher. And a model, again, is Barangay Nyogan and, again, Barangay Potrero, where I'm from, in Malabon, which used to be one of the dirtiest barangays in Metro Manila, but actually won a Clean and Green Award. And the other week, there was just a World Bank group that visited it, and I was able to transform the barangay where I was born, because I altered the law, and I said, pag hindi nyo yan sundin, parang na ako'y mangmang na lawmaker at hindi ko napapatupad ang sarili kong batas sa aking barangay. At sumunod naman sila, at marami kami informal settlers, dati open dumps, house to house ang pagdisiplina sa kanila. And they won the Clean and Green Award. So what I'm saying is that it's doable. Can I therefore request that all the rural health units, how many do we have all over the country?
Currently, we have around 2,500 rural health units.
And barangay health centers, how many?
We have 21,000.
21,000. So that they would all have gulayan where applicable and implement RA 9003 ESWM strictly. In fact, if you can send the staff to see how I do it in my office, we have 5 bins.
Yes, we have that in the RHU. 3 bins. The yellow, green, and the black.
That's good enough. Yes. I have 5. O ilang kami. But then, yes, strict, and just to advise them that perhaps one of these days I would just visit any RHU without announcement in any barangay health center to see, even if you say it is under the jurisdiction of the LGU, but it was turned over by DOH, you still would have the authority over them?
Yes, we have technical and supervisory jurisdiction over them.
And a memo from the DOH secretary would be in order, or would that be an infringement on the authority of the LGU?
Administrative order.
Yes.
Yeah.
And you can see, pursuant to the Committee on Finance hearing, we are obliged to do this, of course, yes, to implement it for their own health safety as well.
Yes, yes, Madam Chair.
And when you construct your new health units and health centers, you should have rainwater harvesters so that these rainwater collectors can be used during times na walang tubig. Do we actually implement that? I'm not an engineer, but it would be best to ask DPWH or even look at models in our communities that have rainwater cisterns overhead or underground.
Yes, Madam Chair, as informed by my program manager, we're currently implementing the Green Building Code with concurrent healthcare waste management program and hospitals safe from disaster programs. So we've instructed all hospitals to include rainwater harvesting methods for sanitary designs, continuous provision of funds for non-burning waste technology, and continuous compliance with mercury use phase out in our health facilities, site clearance from field box and MGSB, Pag-asa required for new hospital sites, ongoing structural assessment of DOH hospitals for disaster resilience. So those are the...
Magandang pakinggan at yan ang ina-advocate nating lahat.
Yes,
sana po pinapatupad at sinusunod. Meron ba kayong team na nagmamonitor kung ito po yung napapatupad?
Yes po, we have central office and regional teams going around the hospitals ensuring that they comply with all the guidelines of DOH. And Madam Chair and Senator Ejercito, we're also implemented the undercover patients in the hospitals, meaning that we send DOH employees that we train as artistas, and they pretend to be patients to check how the hospitals are treating them. And then they give us feedback, and then we feed that back to the hospital chief, Madam Chair. Because I was telling our hospitals, if I or my USEX or my ASEX would go to the hospital, of course they will show us the best. But if undercover patients would go to them, we know the real score. We know what's really happening in the hospital.
Good idea. Maybe that's what I should do, my staff, to just walk in and see how they're treated and see.
The bathroom, that's the number one.
Oh, that's very important.
The comfort rooms. Opo.
Okay. You know, I have many questions, but it's almost 8 o'clock. You've been here from 1 o'clock. Can I submit it to you and then email me the answers to the questions? Because these are the same questions I could probably be asked on the floor. So to abbreviate the proceedings.
Yes, Madam Chair, and in fact, if the other senators who were here, I think Senator Joel Villanueva had other questions, we can actually supply all the answers to your questions, Madam Chair. Your Honor.
So one of the most important outputs of this hearing is the convergence with DSWD so that their problem of absorptive capacity of a budget given them for this year can actually help solve, hopefully, the malnutrition problem by providing funds. Of course, it will not solve the malnutrition problem right away, but at least we can provide the gulayan and everything. So I hope we can do something. Can you please micromanage that to make sure that the OIC of TSWD works with ASEC Flores, Bernie? Can you give me your number? Brian, we have 3 staffs. Why don't they work? Yeah.
Yes, Madam Chair, we will see to it that the directives of the chairperson is implemented.
Sige. Yung concerns ni Joe.
I just saw something, no, siguro, Madam Chair, before we adjourn tonight. With regards to medical assistance that was raised by our chair, in 2016 audit report, there was a 186.5 million or 0.513 million worth of assistance that was unutilized. So the reason was cited was lack of public awareness regarding the program. So how do you disseminate information that there are available medical assistance for those who cannot pay?
Yes, sir. We started disseminating the information last year, and that is true. We have a balance. We have a balance of 186 at the end of 2016. But right now, the 3.9 billion allocated for MAP in 2017 were only September, and we have utilized the 3.9 billion. 1.5 lang po yung last year. And there are tarpaulins displayed in all DOH hospitals about the medical assistance program, Your Honor. Mr. Chair.
Actually, I have gone around, and although in the provinces, Madam Chair, although there are 200-300% occupancy, a lot are not complaining precisely because they are able to get, I think, the medical assistance. No? So that's very good. This absorptive capacity about 87%. So this is just 12 to 13% that was not utilized. No? With regards to Madam Chair, no, one of the innovations that you are pushing in polyclinics, when do you plan to implement these polyclinics to upgrade those RHUs to become polyclinics?
Yes, sir. It's in the 2018 budget, Your Honor. So we're building one polyclinic, particularly the pilot is yes. The launching is
Madam Sec, siguro can you brief regarding the polyclinics? Can you brief the chair so she can understand better?
Okay, yes.
It's a good idea so you can decongest the hospitals.
Yes, Madam Chair. The polyclinic is actually our takeaway from our Cuba visit last year, and it's a model where instead of patients flock to the hospitals, they have a standalone diagnostic facility outside the hospital that's called the polyclinic. But in addition to, it's not an RHU, it's really an upgrade. It's more of a hospital, but there's no inpatient because you have X-ray, ultrasound, ECG, and all that, and even an emergency room in the polyclinic.
From the RHU?
Yes, it's bigger and more equipped.
And it's already existing? Not yet?
Not yet. And the idea is that we have specialists in the polyclinic like pediatricians, OB, internal medicine, surgery, psychiatrists, and even rehab medicine. So it actually will decongest the hospital so that also we can have checkups of all Filipinos in these facilities.
How many polyclinics will you create?
For now, our target is to establish 100,000 population, so that's about 1,000 polyclinics in the short term. The pilot is being launched this September 23 in Siargao, but also the Marawi rehabilitation is modeled after this polyclinic.
How many square meters is a polyclinic? Why don't you just equip your RHUs?
Yes.
Why
Some
I mean,
selected RHUs will be converted to polyclinics. But it's more of an infirmary. It's an infirmary type structure without inpatient care. It's bigger, around 400 square meters, and RHU is 200 square meters, Madam Chair. Only one doctor, but the polyclinic has specialist offices.
That's how it is in Cuba.
Cuba, yes, Madam Chair.
How many are we building by next year?
Ilan next year? 300? 300.
Have you mapped it around the country? Whereas if you have difficulty finding the land for RHUs and for barangay health stations, how will you find the land for the polyclinics?
Yes, some of the infirmaries that are already standing and some RHUs will be converted to polyclinics. The new polyclinics will just be very few. As mentioned by my program manager, only 10 new polyclinics will be established next year. But the existing RHUs can actually be converted to polyclinics. And the reason why we're doing this, Madam Chair and Mr. Senator, is that in Cuba, the occupancy rate of the hospital is less than 80%. Because most of the patients are attended to in polyclinics. It will decongest our hospitals because the specialists are brought down closer to the people. Only those who need inpatient care will be brought to the hospitals.
Is it in your budget? Naka-lump sum siya or naka-identify na yung areas?
Sa health
It's under
facility.
HFEP.
Apa.
Is it already identified which areas?
It's in the annex, wala pang specific areas. But we're identifying the specific areas.
When can you submit it to the committee?
When can you submit? Tomorrow. Sigurado ka na.
So it's
Yes,
under the
ma'am.
HFEP
Yes, yes, Madam Chair.
both the construction of the structure or the rehabilitation
Of
the
RHUs.
RHUs and the equipment needed. How
Yes,
about
Madam
the
Chair.
PS, the doctors and specialists?
Currently, we can assign doctors to the barrios and our nurse deployment program. But what will happen for the specialists is they will come from DOH hospitals and rotate to the polyclinics. Nagro-rotate po from the hospitals so that the patients are served in their community and they don't have to travel to the capital town.
How many polyclinics can you finish within the year, next year? 10?
Actually, 10 is new construction, but we're thinking of at least one polyclinic per province on the initial. So it's
80?
about 80.
You have 80 you can move by
Converting,
next year?
yes, opo.
And you said the one in Siargao now is already existing?
No, we're refurbishing it to be a polyclinic. We will launch it on September 23.
You used present year funds?
Yes,
Under HFEP?
yes, Madam
So,
Chair.
under your HFEP funds, you can actually already do your polyclinic.
Models, yes, Madam Chair. And we're doing that for Marawi also. We're establishing, because Marawi has 200,000 population, 2 polyclinics in Marawi.
Okay. For mentioning that, is this the list of polyclinics? What is this?
That's the list of all HFEP.
All HFEP. But would the list of polyclinics be under HFEP?
Yes, some. Kaya lang hindi ko alam kung naka-identify.
I have a question. Under HFEP, nakalagay Municipality of Pitak. Wala naman ganong Pitak na municipality sa Antique, ba't may ganong pangalan? What is Pitak? It says here, under your list of HPAC, I just looked at it, it says Barangay Hinalinan, Barbasa, Antique. The other one, Municipality of Pitak in Antique. There's no such LGU. Bakit ganon? This is HFEP. Oo. This is 2018. Proposal for 18. So this red booklet is the list of all HFEPs. Are these all barangay health stations? Are they rural health units and polyclinics? Lahat na ito in this red book?
Polyclinic, wala pa. Wala pa pong polyclinic
Yes,
dyan.
please give me.
But,
And why is it that in the province of Antique, we only have 2, is this correct? 2 barangay health stations only? And there's a municipality which does not exist. Pitak, what is that?
we will verify with the regional office, Madam Chair. That's submitted to us by the regional offices.
Ilan ba kaya ang nagkakamali sila at anong LGU yan? Paano i-implement kung maling lugar?
We'll review the list again, Madam Chair.
When it says hospital and health centers, pag 1,200, what does it mean?
That's the cost.
Not the number. So, bakit ganun? Sa Antique, 2 lang. Isa pa maling municipality, di isa lang natira, Barbasa lang. Bakit nyo ginaganon? Bakit ganon? Mahirap na nga yung lugar at pinakamataas na nga na malnutrition sa buong Western Visayas at ang ating health center, 2 lang, -1 na Pitak, Barbasa lang. Bakit nyo kami ginaganon? Para naman hindi tagad doon ang inyong chair. Buti pa ang Masbate, lahat ng munisipyo nandun. I only have 18 municipios, hindi pa nyo mapagbigyan lahat. Ano ba naman kayo? Taga-Antique pa ang asawa ni...
We will counter-check, Madam Chair.
For example, in Siquijor, you have every municipality.
Secure.
I mean, I'm happy when I see marami. Kung Batanes nga, 1, 2, 3, 4, 5 municipalities, Antique, isa lang. Ano ba naman kayo? Sino bang gumawa nito?
It is submitted to us by the regional offices.
Halatang natutulog yung region. Halatang hindi niya alam ang Antique. Halatang hindi niya alam ang kahalagahan o pangangailangan ng Antique. Hindi balik kung mayaman kami. Kami na nga ang mataas ang stunting at malnutrition. Tapos isa lang, Barangay Hilalinan, Barbasa, Antique. Ay, nako. I'm gonna cut your budget and okay.
Madam Chair, we've been doing the barangay health stations for the last 5 years.
Baka naman na-comply na.
Baka mas maraming nagawa po in the previous years. We'll just check it,
Yes.
Madam Chair.
O mahina lang talaga yung senator from Antique.
Hindi po.
So, actually, I simply wanted to understand, what is this red book? Are these barangay health stations, rural health units, or including LGU hospitals? Yun ang gusto kong intindihin.
Those are the projects funded by HPEP.
Yeah, funded by HPEP.
Part yan ng submission part yan ng NEP. Tinanggal ko lang.
Okay. Yes, ma'am. Pitak in Tibiao, Antique, Madam Chair. Tibiao.
Ilagay. Is it a barangay? Barangay Pitak, Municipality of Tibiao.
And in 2017, Madam Chair, we have around 25 barangay health stations in Antique.
Ano bang ideal? You said one
per barangay. One barangay health
But we
station
have 590 barangays
per barangay.
in 18 municipalities. In 2017, you only have how many?
25.
Out of the 590.
But
There's already existing.
the base is around 50% are already existing.
Can we please check of the 590? If you have one barangay health center in each barangay. Because remember, it's not because it's my province. It's because it has the worst case
Yes.
of all. Stunting, undernutrition, and wasting.
Yes,
In fact,
Madam
if
Chair.
this report is accurate.
Opo. We will look into it because
And can I
we want
please
equitable
ask for
distribution. Opo.
amendment to this to include other LGUs
LGUs.
and to increase the number of barangays for the barangay health stations.
Yes, Madam Chair.
Malakas yung taga-Masbate sa inyo, no? Marami. Hindi, mabuti naman. Nangangailangan ng Masbate. Hindi man ako nagaselos. Natutuwa nga ako pag marami, oh. San Juan, hindi ko na tinitignan ng San Juan. Yeah. So could you please amend that? Yeah, thank you. It's 8 o'clock. I think we have to call it a day.
Yes, Madam Chair, I think the list is new construction, but we also have a list for refurbishing and upgrading and completion. That's a different
So,
list.
in your
Repair and
submission, within
renovation.
the week of the 590 barangays in Antique, could you
How
please
many?
find out if there is a barangay health station in
In
each
every.
of the barangay and how many RHUs there are, and if the reason for only 2 provision is because it's been already supplied with. But among the many discussions, the DSWD and Nutrition Council DOH convergence for the Sustainable Livelihood Program is of utmost importance because the funds will expire within 4 months. Okay? With manok, BAI.
Go
Kung
for
kaya.
milk.
Sige. So, ibig sabihin,
Kaya
kasama
nila
po nyo,
ubusin yun.
when you meet with Mr. Leco and
Yes.
ASEC Flores with Sec Pauline, isama na nyo si NDA for the goat at saka si BAI. Hindi ko kilala kung sino si BAI, pero patawag
For
na.
the chicken.
Yes.
Yes, Madam Chair.
If they don't follow you, they don't heed you, Brian, you make sure you call them, Nashwin, head of BAI, and tell them what we discussed, and they have to meet with Sec Pauline within the week to do that program for the Sustainable Livelihood Program. So we have the DA, the DOH, and the DSWD converging for this SLP.
Yes, Madam
Okay,
Chair.
thank you. Okay, with that, I forgot, my doctor is here. Oh, doctor, you have your budget. Okay, no more discussion. Do you have your land? Oh, see? Very good. Remember, I fought for you. I forgot that my doctor has been sitting here the whole time. Why is your son-in-law not attending your hearings?
He's at the hearing with Senator Gordon.
Okay. Just kidding you. Thank
He's in the
you.
committee.
Hindi ko na naitanong lahat. Yes, that's fine. No more? We therefore pass, we approve your budget pending the submissions and the convergence with the SWD. Thank you, Sec Pauline, and to all of you. Thank you.